Hi, I'm David Pope from Clinical Edge, and welcome to this week's 5-minute physio tip on low back and pelvis pain and muscle energy techniques. So when I was a young physio, not long out of uni, I completed muscle energy technique courses, and I learned how to assess pelvises for torsions, for upslips and downslips and sacral torsions. Lots of great stuff. I performed lots of manips on upslip pelvises and even had some success. The trouble was that I noticed the next time they come back, that upslip was back there again. So it made me start to question what I was really doing. Now, fast forward a few years, and I had a patient come in not too long ago that said to me, I really need you to manip my pelvis. It's gone out when I press the brake pedal and I've got an upslip and I just need you to put it back into place. So I looked at the patient, and undoubtedly I told people that they had an upslip in the past before, but when you actually look at the anatomy and whether an upslip can occur, you're looking at quite a corrugated joint surface between the sacrum and the iliac, a very strong ligamentous complex around that area. So anatomically, is it possible for the ilium to slide on the sacrum? Not unless you've got some severe ligamentous disruption and or potentially a major trauma. So is it possible to get an upslip? It's highly unlikely. So what about all those patients that I told, we need to do this manip on you, and we performed an upslip manip, yanked on their leg, and they walked out feeling better? Well, undoubtedly we'd affected their higher centers, we'd created some descending pain inhibition, and we'd also stimulated their periaqueductal grey area of their spinothalamic tract. We'd created some change in the neurophysiological output to that area and had a temporary change in their symptoms. But like I said, the next time they came back and I was like, it's back there. So really, was I looking at an upslip? It's not likely. I was actually just looking at maybe some muscle tension on one side, or just regular asymmetries or differences between people that is perfectly normal. So is it a terrible idea to tell someone that you've got an upslip and that we need to manip you and put you back into place? Well, it's definitely not ideal. And you'll see this the more you work in areas where there are lots of muscle energy technique practitioners, that you tend to create this fear avoidance in people. So people get really stressed. This lady was extremely worried about pressing the brake pedal hard, about stepping off a curb, about doing any sort of vigorous exercise in case her pelvis went out again. She thought it was her fault because she'd stopped doing her core stability exercise, or she hadn't been doing an hour of them a day. So you're creating this dependence and reliance on you as a therapist. You're creating this fear in patients of, are they going to do it again? If you're telling people that you've got an upslip, we need to manip you. So if you've been doing that, maybe it's time to rethink your paradigm. You're likely not affecting their upslip. You're more likely just changing a little bit of neurophysiological output, descending pain inhibition, and there's likely a better way to de-threaten your patient's pain and to talk them back into, getting better, as well as incorporating your other treatment techniques as well. So I hope you've enjoyed this week's 5-minute physio tip. I'm going to explore in our next 5-minute physio tip ways that you can explore the pelvis when it can be involved, but it's definitely not about manipping the patient's pelvis back into place. Stay away from it. It's not a great idea. All right, have a great week. I hope you've enjoyed this 5-minute physio tip. If you've found us anywhere else besides on our blog over at clinicaledge.co, go and check us out, all our other resources and podcasts and webinars. You'll love all those as well. So have a great week. I'll see you next time.